Over the past few weeks, we've been getting to know several local businesses that have received high marks from their customers, earning them the Consumer's Choice Award. And that customer satisfaction certainly extends to medical offices. And today, we meet one such place dedicated to your eye health. The Bloomberg Eye Center is known for its state-of-the-art laser eye surgery, but that's only the start of what it offers patients. Dr. Stephen Blousey of Bloomberg Eye Center joins me now with more. Hi, doctor. Nice to have you here.
Hi, thanks for having me. Because
you are so well known for LASIK surgery, I'm not sure people realize you do have other offerings. So what can people get done? How can you help them at Bloomberg?
Well, besides LASIK, we do full scope, anywhere from family eye care all the way up to the diagnosis of advanced disease and even treatments as well.
And I didn't realize that you are local. You have a couple sites, though, where folks can visit you, right?
Yes, we have a main office in Newark, Ohio, and then we have a satellite in Columbus, Gahanna, and then one in Logan.
You also treat eye conditions, so not just nearsightedness and farsightedness. What are some of the diseases that you help folks with?
Cataract surgery, diabetic eye disease, glaucoma, macular degeneration, retinal detachments as well.
Are those mostly, would you say they're age-related eye disorders?
Many of them are, especially macular degeneration, which is usually age-related. Diabetic eye disease comes along with maturity as well. Cataracts obviously is one that's seen more in maturity as well.
How are we doing with being able to help folks who have any of these problems as they age?
Well, fortunately, the advancement of technology has come along to make it a lot easier for us to diagnose and to do treatments as well. Cataract surgery with small incisions, macular degeneration using injections instead of lasers has been an advancement as well.
And what age usually do people start to notice some of these issues?
I always think around 55 is whenever I start looking at somebody to be more apt to be having mature situations.
So even if you haven't needed to see an eye doctor, around that time, 50 to 55 is a good time to go have your eyes checked anyway.
Well, I always like them as young as even 6 months that we can look at things, but certainly as we mature, we need to be checked at least every year.
LASIK eye surgery is something that you at Bloomberg Eye do a lot. In fact, your surgeon has done how many?
45,000.
I think he knows how to do those. How would you explain LASIK surgery, and who's it for?
Well, LASIK surgery is really based, most of our patients are between about 18 years and 60 years. And it's a two-step process. And LASIK is a process where first we start by making a flap in the cornea because you're not able to laser right through the skin of the cornea. It's tough like leather. So we make a flap, and then the surface of the cornea is resurfaced, like changing the lens. And then the flap is replaced again, and it's a 8-minute procedure.
Is that all,
yes.
Really? And what about recovery for anything like this?
Well, it's almost instantaneous. Really, the recovery is very simple. Patients have a few restrictions for a week. Many of them are 20/20 the very next day.
Oh my gosh, it really is amazing what you can do and how quickly you can do it. But for most folks, we're talking about that they can't see far away, right? That's what you correct most of the time?
That is most of in most of the United States is nearsighted. However, we're able to treat farsightedness as well.
Can you treat both?
Yeah, well.
At the same time?
You can do a condition where it's called monovision, and many doctors do that with contacts where we set one eye for far and one for near.
Right. And so then your eye sort of adjusts to that.
Yes.
Once you've had the LASIK surgery, are you set for life, or will your eyes change and that you might either have to have it again or it stops the progress and doesn't work as well?
Most of the time I consider it a permanent procedure. The change to the cornea is permanent. However, the eye, as we mature, will change from the inside, and that may set us up for needing touch-ups later down the road and eventually cataract surgery.
This is the diagram of the eye, and
yes.
So this is that cornea part that you make that
true.
flap over,
yes.
and you go in, and little to no pain for folks, and when they wake up, or are they alert for this?
Well, we do give them a Valium to help them relax. However, I think they're amazed on how quick and simple and painless it is. There's some discomfort that evening, but the next day, when I'm able to see patients, extremely exciting.
Well, we've had information up, doctor, so that folks would know how to get a hold of you, and that's the best way to schedule an appointment, right?
Yes, please.
Okay, great. It's nice to have you. Thank you so much.
All right, I appreciate it. Thank you.